Hi, I'm Dr. Brandon Adams, and in this video we're going to talk about heavy metal toxicities. So some of the more common toxic metals that you may have heard of would be lead, mercury, aluminum, tin, uranium, copper, just to name a few of them. Now, we are exposed to these through the air, soil, food, lotions, many different things, okay? So avoiding these metals is a very hard thing to do. So they're always going to come at our system. So what's important to know about that is our bodies are bioaccumulators, which means we can build and build and build levels of these toxins or other substances in our system. So, for example, if we get exposed to any one of these metals, let's just say arsenic, it's going to go through our bloodstream. And if our body cannot get it out within a timely manner, what it will do is going to store it. It's going to store it away so it can create as little damage as possible. So it's going to store it in a gland, like your thyroid gland, your parathyroid gland, thymus gland. It's stored in organs, like your liver, your brain, kidneys, joints. So your neck, your back, your shoulders, your elbows, fingers. Now you start seeing arthritis come in because of that. So some symptoms that you may see from a chronic exposure would be fatigue, constant pain, brain fog, muscle cramps, dysmenorrhea, so problems with menstrual cycles, whether it be heavy cramping or no cycles at all. Chronically acidic pH. You know, trying to get someone's pH up when they're so burdened with metals is a very tough thing to do. So removing some of those metals, you may see that pH begin to raise up a little bit. Joint discomfort, because your body's going to stick it right in those joints. So, you know, if you always have a stiff neck and it doesn't respond to some of the normal therapies you're doing, whether it be stretching, exercising, getting adjusted, or other things like that, maybe it's burdened up with arsenic or lead or cadmium, one of those. Hormone imbalances, that's a big one because that's a very noticeable one. So people with hormone disorders definitely know it, and heavy metals could be one of the bases of that dysregulation there. Weight gain, and it's really tough to lose weight when we're so toxic because our bodies are going to be creating fat cells to help store some of these toxins in it. So losing fat in a toxic environment is a very hard thing to do, and if you do, there's a good chance you're going to gain it right back. Dry skin irritations are huge with heavy metals because the body's going to try to get some of it out. So skin is part of your detox organs, so if it can push some of it out through the skin, it's going to try to do that. And if it really is a real sluggish process, you may see some rashes, chronic dryness of the skin, and definitely just irritated. Maybe feels like the back of your hands may be sunburnt if you're not detoxifying properly. Headaches, heavy metals getting stuck in the brain can create headaches big time. Liver congestion. So the question, how do I get them out? All right, so first one is trying to avoid exposure, which is very tough. But there are some things that you can just be smart about. Obviously lead paints, they don't really use them anymore, but that would be an example. Don't use lead paints. Don't put like a whole lot of so if the back of your lotion it says this many ingredients, probably a good thing not to use that one, especially if it's all chemicals and things like that, because heavy metals hide everywhere, guys. So avoiding exposure is a very tough one, but there's just the common sense things you can do sometimes would be the only way you can do it. Oral chelation. We use certain oral chelators. They're all out there. You got DMSA, EDTA, chlorella, cilantro, garlic, vitamin C. Those are oral chelators. So we can use those in a certain way to help your body pull metals out of the system and just get them out of the body as best possible. Make sure you're doing it in a safe way though, so it may be best to do it doctor supervised there. Infrared sauna is a really good one. The infrared, there's a difference between a dry heat sauna and infrared. So infrared produces the infrared waves that go into your body, so it heats you up from the inside out. So it helps those cells release some of those metals so you can sweat a lot more of it out of your system. So it's a very beneficial thing to use on a daily basis or a consistent basis to help detoxify your system. Now, if you go too much too soon, you can feel actually pretty sick by doing this. So be careful with that one as well. And another thing we use in our office is a type of homeopathic detoxification process where we kind of trigger certain metals out of certain organs. So There are very few people in the country that do this, and we are one of them. So it's a FCT, homeopathic detoxification process. It's very effective, and this is one of the things that we do for most of our patients here. So that's heavy metals in a nutshell. They're everywhere, guys. You got to get them out of the system, or you're going to start seeing some long-term issues. Thanks for taking the time to watch the video. I'm Dr. Brandon Adams, and I hope you have a great day.